It was a shot seen around the world. On December 14th, a Queens ICU nurse became the first person in the country outside of clinical trials to receive a COVID vaccine. It began the largest vaccination effort that's already come with plenty of obstacles. Long Island Jewish Medical Center ICU nurse Sandra Lindsay had no idea she volunteered to be in the history books.
Protecting myself, the community, my patients, my family, leading by example, and also instilling public trust.
The medical community was first in line for what had become a long-awaited scientific breakthrough.
This never would have been possible without the volunteers who took a risk and trusted us and came in and were willing to help us find out if the vaccine was safe.
More than 1,000 New Yorkers volunteered to participate in NYU Langone's various clinical trials that included the Pfizer vaccine. Their results added to similar trials around the world.
It's a lot of phone calls and very intense study visits and blood draws to make sure that the vaccine is safe.
All of that before the FDA approved it for the general public. But getting a safe and effective vaccine was just the first hurdle.
If they don't give us vaccine, they don't vaccinate us, at least give us an appointment.
Cumbersome online portals to make appointments to limited vaccine supply led to mounting frustration as eligibility widened.
What you want to do then is go to the point of the pain.
The data across the tri-state area showed an alarming trend. Black and brown communities hardest hit by COVID were the least likely to get the vaccine. It was first blamed on hesitancy based on years of mistrust of the medical community. But Reverend Dr. David Jefferson of Metropolitan Baptist Church in Newark saw an even bigger issue.
We in particular do not have a ton of Walgreens and CVS in our community. But guess what we do have? We have churches.
After pressing state and local leaders, vaccines arrived at Metropolitan's community center. Jefferson was among a coalition of pastors who rolled up their sleeves to show their faith in the process. Now Metropolitan has a waiting list of others ready to do the same.
We had 1,000 people that had registered that needed vaccines. I got a call that we're going to have 1,000. And we're going to be able to clear those people.
Across the region, neighborhoods that were once hotspots are now beginning to be prioritized. Meantime, the coronavirus is mutating into a more contagious disease and remains a threat.
The volume is not there, but the clinical conditions just as bad. And as I said, younger and younger.
It creates an even greater sense of urgency to get more shots into people's arms.
Very likely the end of May, the beginning of June, when we will have many, many more doses of vaccines that you could actually give to people.
And it's the key to getting to a new normal. The FDA has approved Johnson & Johnson's COVID vaccine. It's one shot, effective in preventing serious illness, and does not have the same refrigeration requirements as Moderna and Pfizer's vaccine. It's been described as a game changer that will provide a much-needed boost to the vaccine supply. Aundrea, Cline-Thomas, CBS 2 News.